finish. Don't do anything. So here now if we want to, okay, so after trunk, next is proximal stability. Proximal stability means this is proximal, this is distal. If I want to do any activity, I need proximal control. How to improve this? Now, hold here, hold this.
Yes,
With the other hand. Now, what you have to do here is flip. You have to do this. Come on, with both hands, with both hands. Okay, so here you are going to improve the proximal stability of muscles. Okay, proximal stability. This is proximal stability. Okay, so now I want everyone to check how your muscles are working. Do this. Where you are feeling strain, you are not simply like that. You have to do something. Okay, definitely if you do this, your proximal muscles will get strengthened. Proximal. What are all the proximal muscles? Now tell me. What are all the proximal muscles? Yeah, tell me what shoulder muscles. Supraspinatus, infraspinatus, teres major, teres minor. Anything else? Subscapularis. More. Okay. Now, what are the muscles that attach the spine with scapula? Trapezius. Then any other muscles? Serratus anterior. Serratus anterior. Any other more muscles? You have heard about rhomboides major and rhomboides minor. Okay, they are the muscles which will hold your scapula like this. So if you do this, you will get your rhomboides major, rhomboides minor, subscapularis, trapezius, everything to get work. Only then person can do this activities. If there is no, patient can't lift and he can't able to do the activity. Okay, so this is upper limb control activities. You can do it, lie down. So here also, you can ask the patient, initial stages also, ask him to hold the limb, okay, without dropping, okay, then bending and what is this movement? This is for proximal and also for triceps. Down and up. While down, what type of control? While up, what type of control? Down, what contraction of penis? Eccentric contraction. Up, concentric contraction. Like this, so many of things are there which you have to work. Okay, and more advanced therapies. More advanced therapies are partial weight treadmill training. Partial weight means two therapists will be there. Two therapists will be there. Patient will be suspended like this. Okay? Means if he is having 70 kgs, the weight he will bear on the foot will be 20 kgs. You understood? Now if I am walking, how much weight I am bearing? Let it be I am 80. How much weight I am bearing on my foot? 80. You understood what I am telling? Now in case of partial means weight. Partial means only half of the weight or percentage of weight will get reduced. So they will hang with the, okay, with the harness. Harness, this is also a harness. Okay, they will put and they will make the patient to walk on treadmill. Okay, so where the person will bear 20% of his body weight, 30% of his weight. So progression, first 10%, next 20, 30, 40, 50, 60, like that slowly they will rehabilitate a person for full weight. Understood what I am telling? Okay, so they will use harnesses. How many therapists required for this? Two therapists. One is to hold, one is to get the affected limb forward and up. Otherwise what will happen? The leg will go like this. You won't keep it, no? So one therapist on the down, one therapist to maintain the body position. Okay, that is partial weight supported. More advanced now is robotic assisted training. Robo. Okay, this is now advanced one. What is that? Robotic. So patient will initiate, robo will do the further things. Okay, this is to learn the movement. This is for what? To learn the movement. Who will assist here? Robo will assist. Okay, so this is what? Robo assisted training. Okay, understood? Okay. There is one more therapy called mirror therapy. What is that? Mirror therapy. Mirror therapy means, okay, he will keep the hand. Okay, he will keep the hand. He will do movement with the one hand and he will try to do the other movement seeing in the mirror. Seeing in the mirror. This is what mirror. So that will give a positive feedback for the patient. Positive feedback for the patient. Mirror therapy. What is that? Mirror therapy. Feedback for the patient to do a movement. Okay. Next one is constraint induced movement therapy. What is that? Constraint induced movement therapy. Now what is the problem here is, some people, some persons who had stroke, even though they had some power, they won't use their hand. You understand what I am telling? If I had right hand affected, there is some power, I can try, but patients won't use this. So what they will do here is, they will tie the other hand. They will tie the other hand. They will make the spring, they will tie. So definitely what he has to do now, he has to definitely use this affected hand for his activity. So that is what? Constraint induced movement therapy. Constraint means what? You are constraining normal limb. Constraining means restricting. Inducing means facilitating the affected limb. For what? Movement. Understood? Constraint induced movement therapy. Constraint induced movement therapy. Okay. So these are all the therapies which you can use in strokes in advance. In advance, not in basic level, in advance. Okay. With that we will finish.